Today, I would like to introduce a paper our team submitted to the journal iMeta, titled, Intratumoral Enterobacter hormaechei drives gemcitabine resistance in pancreatic cancer, via cddL-mediated drug inactivation. Pancreatic ductal adenocarcinoma, PDAC, is associated with an exceptionally dismal prognosis. Although gemcitabine remains the cornerstone of systemic therapy for PDAC, its clinical efficacy is frequently compromised by chemoresistance. Emerging evidence indicates that intratumoral microbiota can modulate therapeutic responses through the direct metabolic degradation of chemotherapeutic agents. For instance, certain bacteria express the long-isoform cddL-mediated (cddL), which effectively inactivates gemcitabine. Nevertheless, previous mechanistic investigations have predominantly relied on laboratory model strains, leaving a critical gap in the systematic profiling of viable intratumoral bacteria and their functional characteristics within real-world clinical tumors. As an important opportunistic pathogen, whether Enterobacter hormaechei can colonize tumor tissues and directly orchestrate PDAC chemoresistance remains elusive and warrants urgent investigation. By combining 1,6S rRNA sequencing and large-scale culturomics, this study identifies Enterobacter hormaechei as a critical intratumoral driver of pancreatic cancer chemoresistance. Mechanistically, the bacterial enzyme cddL efficiently inactivates gemcitabine, whereas cddL ablation significantly reverses resistance in vitro and in vivo. Translationally, an antibiotic co-treatment strategy effectively eradicates intratumoral bacteria, potentially allowing a 50% chemotherapy dose reduction without compromising anti-tumor efficacy. Finally, pan-cancer analysis demonstrates the ubiquitous presence of Enterobacter spp in solid tumors, highlighting microbe-mediated drug inactivation as a broad-spectrum resistance mechanism. 1,6S sequencing reveals a proteobacteria-dominated PDAC microbiome, with Enterobacter spp present in 37% of cases. Culturomics further identifies E. hormaechei as the most frequently isolated viable bacterium. In situ tracking and patient follow-up show that colonization by this active pathogen dictates a dismal prognosis, mostly fatal within 1 year, highlighting it as a critical dominant colonizer, linked to adverse clinical outcomes in PDAC. Functional screening shows that Enterobacter hormaechei strain A64 rapidly metabolizes gemcitabine into inactive dFdU, exhibiting profound drug inactivating capability. In vitro and in vivo assays confirm its colonization significantly diminishes gemcitabine efficacy. Clinical cohorts further identify Enterobacter colonization as an independent risk factor for resistance and adverse outcomes, establishing it as a critical driver of PDAC chemoresistance. Genomic sequencing revealed that Enterobacter hormaechei carries cddL, a gene encoding a long-isoform cddL-mediated. Kinetic assays showed that cddL efficiently inactivates gemcitabine, while mutant strain evaluation confirmed that cddL ablation abolishes this drug metabolizing ability. In vitro and in vivo studies demonstrated that cddL deletion entirely reverses the resistance phenotype and fully rescues gemcitabine efficacy, pinpointing cddL as the essential molecular driver of chemoresistance. In vivo tracing verifies the stable, long-term intratumoral colonization of Enterobacter hormaechei. Therapeutic interventions show that targeting viable bacteria with antibiotic co-treatment effectively rescues gemcitabine efficacy, potentially allowing a 50% chemotherapy dose reduction without compromising anti-tumor activity. Additionally, pan-cancer analysis reveals the ubiquitous presence of Enterobacter in various solid tumors, highlighting microbe-mediated drug inactivation as a broad-spectrum resistance paradigm. Conclusion: this study demonstrates that intratumoral Enterobacter hormaechei drives pancreatic cancer chemoresistance via cddL-mediated gemcitabine inactivation. Targeted clearance of this pathogen restores drug sensitivity, potentially allowing for a halved chemotherapy dose. Pan-cancer analysis validates Enterobacter as a widespread mediator of resistance in solid tumors. Ultimately, our work establishes novel targets and translational pathways for overcoming chemoresistance via microbiome modulation.